So, hello and welcome to all. I am Dr. Asavari Sawant from Elets Technomedia, and today we will be discussing a very interesting topic all around the subjects of oncology with a renowned oncologist with us. We have Dr. Lalit Kumar, who is the chairperson of oncology and BMT at Artemis Hospital. So, sir, thank you so much for joining us. We are so glad to have you.
Thank you.
Great. So, sir, can you please introduce yourself to the audience and also share little bit about your background into this field, how you got into oncology, what interested you? We are not sure if there was one, big, moment that turned you towards oncology, or was it a series of things that happened in your life that got you interested in this? We would like to know more.
Okay. Well, I graduated from SN Medical College, Agra, and did my MD also in medicine. And one of my mentor always motivated me to go for oncology or immunology. So after my MD, when I came to Delhi and reached All India Institute of Medical Sciences, New Delhi, and I approached for residency to find out if there any opening available. And the day I reached, that time the senior agency position in immunology was filled up already, and there was one position in the oncology. So I happened to join in medical oncology, and that's how my career started.
So,
Subsequently,
sir, yes, yes, sir, please continue.
after initial 1.5 year at AIMS, New Delhi, I went for DM Medical Oncology, which is one of the super specialty program. And that time in country, it was only in Cancer Institute, ADR, Chennai. So I applied there. They called me for interview, and I got selected. So I spent my 2 years there. Subsequently, I returned back to AIMS. Initially, like if you go in different way, initially like your ad hoc and regular posting. So that's how I joined in the faculty at the AIMS and continued till my superannuation in June 2022. And from August onwards, I have been at the Artemis Hospital. In those days, like bone marrow transplant was one of the new treatment, and there were hardly any facility. That it was started at CMC Vellore, and some beginning was made at the Tata Memorial Hospital. And in the North India, there was no center doing the stem cell transplant program. So my mentor here, Professor Kochpilli, she was the one who motivated us that we should start this program at AIMS. So I went for a fellowship to Commonwealth Fellowship for 1 year at the Hammersmith Hospital, and I had opportunity to work under Professor John Goldman, one of the pioneer in the field of bone marrow transplant in that time. And once I returned back, then we started this program. And that time there were hardly any facilities were available. It was just from the kind of we had two small rooms in the cancer department at AIMS, which were like side room kind of thing. So which we got converted into the just makeshift arrangement to for the transplant program. And initial we started there for a few years, and then after the building got renovated, we had the one full floor of the 9-bed floor of transplant program somewhere in 2005, I think, and then we continued transplant in that building. So that's how the journey went on. And since there were very few people in those days in the faculty, so apart from transplant, I was also asked to look after the other, especially the gynecological malignancies, which was one of the area. There were no faculty available, and I when I worked at Cancer Institute at AR, my mentor Dr. V. Shanta, one of the very renowned person. So she motivated that you should be working in the look after these gynecological cases. And these were the very few people were interested in from medical side to really so that's how I. So these are the two areas which really became part and parcel of my interest or passion, you can say it.
Thank you so much, sir. It is so interesting to hear from you and also to our audience. Dr. Lalit has been awarded with BC Roy Award in 2008, which is the highest award by the Indian government in the medical category, and also been awarded Padma Shri Award in 2014. So, sir, I mean, there are so many things that all the viewers are looking up to you to know more from you. So, my next question to you would be, in your years of experience, in your 30 plus 30 years of experience in oncology space, what has been the difference that you observe, things that, or the facilities that were not available then and are available now in this year era in India, and how the difference has impacted in the better treatment and better care that all the doctors are giving in India?
Right. Actually, the situation really had changed a lot in the sense, like as I said, in the somewhere in 1992 or 93, after I returned from fellowship, we started with these very two small rooms, and the ward also used to be like open ward, and we had hardly like 5 beds to begin with, and later on we right now, I mean, at AIMS they have 30 beds, general beds for the patients, and 9 beds for the transplant, and a big daycare unit separately. So in those days, you can imagine like with the managing with the 5 beds, and I think there were only 2 or 3 beds for the daycare. So it was very very tough, and you really have to work overnight to really cope up with the load number of patients and the load, and gradually. So that was one. Secondly, the drugs, which like anti-cancer drugs, were very very expensive in 90s. It was only after, I think I would say, 2000, year 2000 onwards, the drugs really got cheaper, and it was so difficult, and we all the time we have to struggle to find out the drugs, to arrange for the ask the people, philanthropic people, to make some donations, get some drugs for the people, because like aims, they will, I mean, most of your patients would be like coming from the northern part of India, from very very poor background, and were really difficult for them. And the other interesting thing, like in those days, like people were so poor. Sometimes you can even see the people even with the bare feet, hardly even not even having sleepers. So that was a kind of situation. The facility, the infrastructure, the drugs, all those things were not there. But now, I mean, things have really, there is sea change, in the sense you have number of beds have increased. The free medication, that anti-cancer medication, which came available in 2007 onwards, with the help of some of our seniors, my mentor, and now till today, these drugs are being given free at AIMS. So I'm so proud of working in that area. So that was the one. Then the facility for diagnostic facilities were also very, very initial, I would say, or primitive in those days. But as the things started moving forward, the lot of facilities became available at IMS. Also, the pathological facilities and the various biomarkers and other things. So that really helped us a lot. And the colleagues, and we could make the teams in the pathology department, the radiology department, and many other departments who really helped us and who took interest in the field of oncology as a colleague, and which helped us to uh, do the complete workup for these patients and do the treatment point of view. So there has been kind of huge change, and of course the government also gradually, the funding started from the government, and a lot of I mean grants, the financial aids came from PMO office, and then many other state governments and other things, so the people could get some of the help from these people. So things gradually, but it has been a very very long journey, I would say that. And but it has been kind of worth in the sense seeing starting from the beginning, and now what you see today is much better for the, especially for the youngsters who are in this area. They could see the things are already available, so they don't have to struggle for basic things. So in those days, I mean, those things were little not easy. So we have to really run around from one place to another to get all these things done.
Thank you so much, sir. That gives us a very good, insight into how it was like before. Because all you get to know, if you are not in the medical field yourself, is through movies and TV series and those kind of things of how medical services were back then, without having, having faced it yourself. So, getting a proper insight into how the India has progressed in terms of oncology care is marvelous. But when it comes to fear of cancer, we would like to know that, these days more and more people are coming out discussing about having acquired cancer, having battled cancer, and having won over cancer. So people do not fear it as much. But in your experience, seeing people day in and day out, what is the status of around people's thoughts and perceptions around the fear of cancer?
Yes, actually, it depends many times. I would say the one of the important factor being the background of the family or background of the people. So many times, like when you deal with the people who are from the very low socioeconomic background, many times they may not probably understand the seriousness of the situation in the beginning, and I think that is one of the reasons they come very late also. So, because as long as they are able to work, they are able to go for their job, they feel that, okay, I will only go when they become too sick. They cannot even cope up. So, on the contrary, now situation has changed a lot. A lot of people now, when the work system, which I am working these days, we are able to see the patients earlier also, compared to what we were seeing like them 30 years before. Even today also, we get people who come very late. So the attitude and the behavior of the people and the family, which is very important, that they really have to understand that this, if you come early, this becomes easier to make diagnostic investigations, do the treatment in time. Sometime if you're too late, this becomes very difficult for the medical people to really help you, in the sense that somebody who is very sick, I mean, it may take a little long time, and things may get, even complications can happen much more, because you are too sick, your body not able to take up. So that is one thing which I would say, though it is improving gradually, but it's still uh, not remarkably like what you would really expect people to come much forward much earlier, rather than waiting for things to when the body not able to take up it anymore. So that is one thing I think I would suggest the public or people that if they have any problems, anything they have some doubt or somebody suggested, they should get it done, investigation done completely, so that at least the treating team also gets little time to help you out. So that is the one thing. The other thing I would say that in the earlier days, like diagnostic facilities were limited. We had only ultrasound, and in later and after a couple of years, we start getting CT scan done routinely. But these days we have the PET scan and many other investigations which are easily available. So sometime probably we are overusing also. Or in other words, I would say that time like the more emphasis was on the listening to the patient, their detailed history, examining them, trying to make a kind of algorithm, okay, what could be the reasons for these symptoms and the findings which he has in his body, and the investigation. Then you try to make a diagnosis and do the limited investigations, and then you go for treatment. But these days, since your more emphasis has become on the technology, you more investigations rather than interacting with the patient, listening and going through the clinical part completely so that you can really get. So that is in one way dissatisfaction also, especially for the senior people, like the people who are little elderly. They want somebody should listen to them, and these days younger people may not have that many time, that much of time to. They said, okay baba ji, khatam karo, let us uh, go for these tests, and then we can start treatment. So वो एक थोड़ा सा एक रहता है problem, but I think so that is which is very very important for any medical person, any field. So unless you listen carefully, you do the touch the put your hand and examine. I mean, it gives a huge satisfaction to the other side, to the person that some doctor has listened to me, he's examined me, and he made some kind of diagnosis. Gives you much more confidence with each other. And thirdly, obviously, you investigations are important, has to be done, whatever necessary. But overdoing investigation will not help you in making the diagnosis. That is what I would say. So it has to be carefully analyzing the investigations and making a kind of algorithm that this is what you are dealing and how it can be done. And next point, which I would say, like once you have made a diagnosis, because sometimes many of our people they will jump on the outcome rather than going, because the outcome is something which will come only after a few months or few years. This is not something, so they will immediately people. I mean, obviously, the patients and their family members would be interested. Is it curable? That's the first question they always ask. Or is it curable? What are the chances? So people start answering those questions, which becomes little difficult. So because unless you treat them properly, because many times things can keep on changing also. So I would say that medical people should try to avoid giving kind of thing that you have 6 months or you have 1 year or you have 2 years, because that is something which is not really in your hands. You have information available from the various clinical trials and from the textbooks. You can give some probability that in a stage like this, these are results are like, these are the kind of results. So one has to use a clinical common sense and use your judgment in such a way so it's not kind of hurting to the people also. That is very important, because suddenly when they listen that negative aspect, they suddenly become very very kind of start feeling dull and feeling low, and then they like from you they will go to another person, because they want to always listen the, he told 50%, somebody said 70%, somebody said 80%. So those becomes kind of a very difficult situation. So fourthly, I would say that the important thing in any medical treatment is that your interaction with the patient, your and about positive way. I mean, if you explain everything in a positive way, I think that becomes much better way of handling a situation rather than, yeah,
Thank you
that's what
so
I.
much, sir. So thank you so much for sharing all these points. This would help not only the people who are watching have somebody, in their family who is, affected with these cancer, or and also people who are in the industry who are watching this video and aspire to be oncologists or take up oncology field. This would happen help with them as well. So my next question to you is, in shaping the future of oncology in India, what specific focus areas do you believe the Indian healthcare system should prioritize and why?
Okay. Uh, that's a very important point, and so I think we have a lot of facility these days in many states. So they're giving a lot of the financial aids also, and now we have Ayushman Bharat and other things. So there a lot of things are now available. I think what we lack is that we have a comprehensive program. In the sense, let me explain you. For example, the incident number of cancers, they are not same in each state. Some cancers are common in particular area, other cancers are in another area. For example, if you see in Punjab, like if you see the figures, the food pipe cancer is the number one cancer among the men in the Punjab, and in number three in women. While it doesn't figure out in the first five in Delhi or other states in India. Similarly, gallbladder cancer is more common in the northern India, including Delhi and the northern belt, but it's very uncommon in the South India, very much less. So, so these are the kind of, so you have to, government has to really now make up a plan with the help of state government. The common cancers which are very common there, can we prevent them? Because the once you have advanced, you see the amount of money or expenditure you put on these things is there's no end to it. I mean, it's really huge amount of expenditure. Still, your results may not be very good. I mean, the what we used to explain earlier, that in stage one or stage two, which we call it early stage, the outcome, long-term outcome, is like more than 80% people get cured. But in advanced stage, the results may be other way around. It may be 20%, 30%, 40%, that kind of thing. So despite all your efforts. So therefore, your effort has to be on the preventive aspect. So if you pick up these cases, if you cannot prevent them, but you can pick up them early. Fortunately, the health minister, our Nirmala Sitharaman, has announced that from 9 to 14 years age of girls, they will provide one dose of vaccine, HPV vaccine free. So, which is really very good. And we hope that cervical cancer, which is one number two cancer in India in general after breast cancer, if we can run these kind of programs, maybe in 20 years' time, WHO has made a kind of requested that we should make efforts to eliminate this particular disease by 2030. But my guess is by 2040, at least, we will be able to reduce by more than 50% the incidence what it is today. It's somewhere 10.6 per 100,000. So hopefully it will be like less than 5 or 6, which is like a normally, which we can able to manage that. So, so allocating resources little more appropriately in the and finding which particular area has much more incidence and what could be the factors which may be responsible for in that area, whether it's a diet. Because the second point, I will come to this. Almost one third of our cancers today are related to lifestyle. So diet is one of them, very important, and especially people eating junk food and not taking healthy diet has become one of the very important reason that we are having high incidence of colon cancer. A lot of young people in 30s coming with the rectal cancer, colon cancer. So because of the dietary habits. So they start eating from very young age, and by the time they are in the third decade or fourth decade, so I mean, so they've not even started their career by their 35, 36, and suddenly you end up into this kind of problem. So that is very kind of very depressing for you as a medical person also, how to really handle such young people. So, so that is so. There's some efforts have to be done now. Okay, how we can really change the behavior of people to take more of healthy diet. So that is one, and obviously the people who are supplying that has to be ensured that they provide the healthy diet. So that is the second thing I would say. So vaccination, preventive aspect, and lifestyle. And third thing, of course, we all have been knowing that tobacco related. We still see people coming eating the pan masala or supari and tobacco chewing, coming with the huge advanced cancer, very advanced cancer. When your jaw is really kind of totally eaten up, it has come out of the on your cheek. So that is very advanced disease, and you can't do much in those cases. Really, you have to undergo surgery, then radiation and chemotherapy, and becomes still the risk becomes risk of recurrence or becomes still almost 50%. So that is the third. So if somehow we can eliminate tobacco totally, and also these pan masala, gutka, and all these things, so they are the one with they are really eating people's kind of health like anything. So rather the government is spending money on the treatment, if we can spend money on somehow that can we can stop the things, because now they have become so easily available on every nook and corner of the street. People having hanging in with the small pawn shops. So that really has to stop. They have to find some method to, because that will be only way to really take care of this. Otherwise, I don't see any other future. Uh, and of course, we will have the advanced techniques now which are coming up. There are a lot of NGS or next generation sequencing, and then we have the digital PCR, we have liquid biopsy. So many newer techniques are being introduced. Some of the advanced centers, they are already doing it. And in our center also, we are doing the NGS also. So many other hospitals are doing it. So, but the this is still not under the people who cannot afford. So obviously, you cannot use it for them. It's still little expensive. But hopefully, in next 5 years, the techniques will become also much cheaper. But using these techniques more appropriately in a proper way, so that it can help you to really find out the people who are the people at high risk, like somebody who is a heavy smoker, he yet does not have any evidence of cancer. So if you can, our research can find out that these are the people who are likely to develop malignancy or cancer in the next few years. So probably trying to convince them that you need to change it, because this is something which doesn't happen immediately. So people don't bother. They said, I don't have any problem. Why should I stop? So we have to really find some of these things.
Thank you so much, sir. And I was coming down to the very second last question of the session today, which is some of it you answered already. Is what are the most promising newer advanced technologies that you have come across in your practice and that you are very hopeful about, that these are going to revolutionize the future of cancer care? So,
Yeah,
any of
absolutely.
those that you would want to mention?
Absolutely. Absolutely. Like we, in our last 5 to 10 years, 5 years, in fact, I would say, we have now especially for the patients, the women with the breast cancer, ovarian cancer, who have the family history, or even otherwise also the young women, we are doing the BRCA1 and BRCA2 test, which helps to pick up at least 10 to 15% of the cases where they may have this mutation positivity. If they have mutation positive, and this can be done by the NGS or PCR techniques from the blood itself, and if they have this mutation positivity, then you have the treatment called olaparib or eucaparib treatment available, which can be given as a maintenance after completing chemotherapy. This definitely has been shown to improve the prolong the survival, and has been recommended and being done routinely in the Western world today. The drugs have now become available in India, but they're still expensive. So, but then hopefully with the once we have generic plants available, this will be easy to for everybody to really use the molecules once. So that is one thing. Other thing I said, the liquid biopsies, especially the lung cancer and colon cancer, where you can monitor your treatment, and also possibly can use for the diagnosis early. As I said, the people who have heavy smoker or so-called high risk population, if you can use some of these techniques and if you find in the blood some evidence of that they may have the malignant cells which are not still picked up by the CT scan or PET scan, but by these newer techniques, they have some evidence, then they can be convinced that you have to go for the under surveillance and probably the early treatment. So these will be the techniques probably in the future.
Thank you so much, sir. And now we come down to the very last question of our session today. That what key advice would you want to offer to the young doctors who aspire to become oncologists, considering your own experiences and insights in the challenges that you have faced in cancer care?
I would say that I mean one way that younger generation is more fortunate that they have these facility being available, from the terms of diagnosis, in terms of knowledge, and in terms of treatment facility which are available, so they can practice that. But it has to be continuous hard work or perseverance. You have to keep on uh, doing the thing in your as a what are you doing with post graduation or your fellowships on field of oncology or any other area that actually will finally help you get the depth of this thing, because medicine is something which you don't expect results within a few weeks or few months. It's like takes little time, and this is not the. So one aspect is see the initial treatment, but the other aspect, as a physician, as the old timer, if you remember, like the physician used to see even the three generations of the family. So like if you have treated somebody today, and if the person has done very well, and if you keep on coming you for 10 years, 15 years follow up, that gives you really a lot of assurance that whatever you have done to him, you helped him to really get through this treatment. So that I think will be the biggest satisfaction as a physician you will get. So always work for that kind of thing, that by person not only today, he should be okay for the rest of his life. He should be a good person to the society. He should be helpful to the community. And if you do good to him, I'm sure he will do good to the community and to the place where he or she is working. So that is the kind of I would say. And I would say that whenever you get opportunity, always keep on telling about preventive aspect, about the diet, about the regular exercise, so that and as a physician, like even the young budding physicians, I would say, they themselves also have to be careful about the diet and the regular physical exercise, which will help them to really get through this thing. So it's the perseverance and efforts, continuous effort, which will finally make the things in the successful in longer run.
So before we let you go, just want to know one more thing, which is your key takeaway message to the wider community of Elets Innovation Talks that is watching. So we have people not just from doctors communities, but also from health tech, diagnostics, labs, all sorts of healthcare industry together watching this program. So what would be your key takeaway message?
So in general, like I would say that the the uh, careful. I mean, the advice about the number one about the diet, the healthy diet, and regular exercise and positive attitude. That is, I think, probably the most important for the from treatment point of view, in the especially in the field of oncology. I think that's what I feel.
Thank you so much. With that, we wrap up this super interesting session, super insightful and informative session with Dr. Lalit Kumar. So, thank you so much for taking out time and
Mm.
imparting us with wealth of knowledge and information. Thank you so much. We would also like to thank our viewers for staying with us till the very end. Thank you. With that, we sign off now. Stay happy, stay healthy. Bye bye.
Bye bye. Okay. Thank you. Bye.
Thank you. Thank you, sir.